Assalamualaikum and good day everyone. This is topic 1 for Unit 5. It's aseptic technique. Specific learning outcomes for this topic. To discuss aseptic technique itself. Number 2, perform a risk assessment to determine when aseptic technique is required. 3, describe the role of aseptic technique to minimize the risk of HCAI. Describe the key principles of aseptic technique, including a clean and dirty workflow. Number 5, demonstrate the application of aseptic technique. And what is asepsis? Okay, asepsis is defined as the absence of pathogenic organisms. So when we talk about asepsis, we mean there is no pathogenic organism involved. So this is the most important part that we need to achieve when we are dealing with our patients for certain procedure, especially the surgical procedures or any procedures that has a greater risk of infection transmission. Okay. So what is aseptic technique then? So aseptic technique is the range of infection prevention and control practices which are used to minimize the presence of pathogenic microorganisms during the clinical procedures. So we have a lot of aseptic techniques available when we are dealing with our patient in the clinic, especially when we are dealing with certain type of clinical procedures. Okay, all clinical procedures involving our patient need to observe at least aseptic technique. So we will go a little bit deeper about aseptic technique soon. Okay. Right. So the question now is, how do we enhance or achieve our aseptic environment, right? No presence of micro pathogens, okay? So for the engineering controls, we need to have PPEs, surface disinfectants, we have covered this before, environmental barriers, which is aluminum foil, clear wrap, rubber sleeves. The one that we discussed before was the film barrier that we put on our dental unit, right? There is also sharp containers and separate bag for infectious waste. So these are the engineering controls that we could do to enhance the aseptic environment. As for the work practice controls, we need to use of antimicrobial soaps, use of hand lotions, one-handed needle capping devices or techniques, use of ultrasonic instrument cleaners, disposable hand towels, a dryer for hands, or infrared activated taps. Means that we don't have to touch the tap or the head of the tap to open the water. Okay, so we just use infrared activated taps, or you can just use the foot activated water tap. All right, so these are the controls that we can do in the clinic. All right, what are the principles of asepsis or aseptic technique? The principles are to reduce the activity in the immediate vicinity of the area in which the procedure is to be performed. Okay, keeping the exposure of a susceptible site to a very minimum. Susceptible site means the surgical area of the patient itself. Checking all sterile packs to be used for the evidence of damage or moisture penetration. So we don't want to use any sterile equipment that has been sterilized but it is damaged. When it is damaged, when the packing is damaged, means it has no sterility anymore. Okay, ensuring all fluids and material to be used are in date, so there's no expired items. not reusing single-use items. Okay, so we have covered this one before. Reusing single-use item is not acceptable at all. Ensuring contaminated or non-sterile items are not placed in the sterile field. So only sterile item can be put in the sterile field. Okay, so when we discuss about pre-treatment protocol soon, so you know what to be put at the sterile area. All right, so we will cover this later. Ensuring appropriate hand decontamination prior to the procedure. So we have covered about hand hygiene, protecting uniform clothing with disposable apron. We did cover this as well. Instead of apron, we're using clinical gown, or they can call it as disposable gown as well. And then last but not least, for any surgical procedure, we might have to use sterile glove. Not might, but we have to use sterile gloves. Okay. All right. So let's look at these two types of aseptic technique. One is standard aseptic technique. The second one is the surgical aseptic technique. Okay. So let's look at the standard aseptic technique first. When to use this standard aseptic technique. So any clinical procedures managed with the standard aseptic technique, which should be technically simple, short in duration, roughly around 20 minutes, and involve relatively few and small key sites and key parts. Okay, what are those key sites and key parts? Means instruments, surfaces, or any touching involved. Okay, so those are the key sites and key parts. Standard aseptic technique requires a main general aseptic field and non-sterile gloves. So there's two main things here. When you are using a standard aseptic technique, it requires a main general aseptic field. Means there is area in your dental unit cubicle or dental cubicle whereby you establish that area is a aseptic area or field. All right, and you may use a non-sterile gloves. So the use of these critical microaseptic fields and non-touch technique is essential to protect key parts and key sites, the instruments, from contamination. Okay. All right, let's look at surgical aseptic technique. It is used when procedures are technically complex, involve extended periods of time, large open key sites, or numerous key parts, surfaces. Okay, and to counter the risks, we a main critical aseptic field and sterile gloves are required. So in dentistry, normally we use surgical aseptic technique for surgical procedures or dental extractions, or any root canal treatment that will take a little bit of time. All right. So this surgical aseptic technique should still utilize critical micro aseptic fields, which is a very small field, not to mix with other field in the on the cabinets. No, sometimes we actually use tray. We use an examination tray, which we will show you later on. Okay, so just put in your mind there are two types of aseptic technique. One is standard and the other one is surgical. You will know what I mean later when we go over this unit in later topics. Okay, so surgical aseptic technique normally for the surgical procedures, standard aseptic technique normally we use for dental treatment, which is non-surgical base, fillings, scaling, right? So we use standard aseptic technique. All right. All right, this is the examples. The table show you some examples of the procedures when to use standard or surgical aseptic technique, and then the rationale why it is suggested as such. So if you look at from restorations and endodontics, simple extraction, scale and clean, root planning, surgical extraction, they are sorry, just until scale and clean root planning are using standard aseptic technique. Okay, so this is non-surgical technique. But for surgical extraction, full clearance or multiple extractions, biopsy, surgery, everything else need to use surgical aseptic techniques because those are surgical based, and furthermore they possess more risk of infection and they involve bleeding blood. Okay. Okay, this is one of the example standard aseptic technique. This is one of the many. So this three photos are showing you how you open the packaging of an instrument that is sterile. Okay, so the first photo at the top here is actually opening a sterile package of an instrument. So this person is opening without touching the instrument, and when she opens, she will pull these two sides opposite. Okay, once the instrument is exposed, the person who are doing the procedures will grab the instrument without touching the packaging, without touching the packaging, and she or he will just touch the instrument and pull it like this. The photo on number 3. So the assistant here does not touch the instrument at all. Okay, so that's how we do it. All right, so that is just example of of aseptic technique. So we will learn more about aseptic technique as we go along to the topic. All right, thank you.